Yeah, ma'am.
So
Yeah,
let's
you
go.
can proceed with the live stream now.
So let's go on with the second question, which is a 56-year-old female comes with complaints of lump in the breast. History of loss of weight and appetite is present. So history of loss and appetite, as we already spoke, might indicate a malignancy. On examination, the breast looks as in the image. So there's an image given here, and this is classic symptom of what? Purdy orange appearance. This is classic of purdy orange. So let's see what he asked. True among the following. He's asking the true statement. So, okay, let's see the options. The first option, this is due to involvement of Cooper's ligaments. So he's telling that this is due to involvement of Cooper's ligaments. This you have to remember. Purdy orange is due to involvement of dermal lymphatics and not due to Cooper's ligaments. But you also have to remember two other things, which are dimpling and puckering. This dimpling and puckering, these two are due to involvement of this Cooper's ligaments. But purity orange is due to involvement of lymphatics. These two might come as a question. And let's see this. So this is a false option. The second option, this is the most conspicuous sign of breast carcinoma. So purity orange is the classic sign of breast carcinoma. So this is a true statement. Let's see the third one. Triple assessment includes mammography, FNAC and CECT. So triple assessment is done for like breast carcinoma, which includes radiological findings, clinical findings and histopathological findings. This radiological investigations which are done is mammography. And for the clinical, we see this purity orange, dimpling, puckering, ulceration, all those. Histologically, what do? We take a true cut biopsy or an FNAC. These investigation of choice is mammography. So mammography is the investigation of choice for screening but not for the diagnosis. So this is also a false option. So the correct option is what? Option B. Purity orange is the most conspicuous sign of breast carcinoma. First you have to identify this as purity orange and then you have to go to the question. Purity orange is due to what? The dermal lymphatics. Okay. Let's go for the next question, which is correct combination among the following. He's asking the correct combination. Like you have to match these. So what did he give in the first option? He gave the calcium oxalate dihydrate. These are all what? The renal stones. So he's asking which type of stones has what type of shape. So let's see the first option, which is calcium oxalate dihydrate. Calcium oxalate dihydrate has which shape? You have to first identify these shapes. This is what? A benzene shape. Benzene shape or a hexagonal. Six-sided, no? For the 6, you remember it as cystine stones. 16, like it's like 6, no? Cystine stones are in 6-sided shape, like the hexagonal shape. So let's see the other one. So these are which shape? These are the coffin lid shaped crystals. Coffin lid is for what? This is for struvite stones. You have to remember this. This has struvite stones. Struvite stones have a coffin lid shaped. And what is the third picture? He's showing this dumbbell shaped lesion, dumbbell shaped crystals. So the dumbbell shaped are seen in what? Calcium oxalate monohydrate. You have this in calcium oxalate, you have monohydrate stones and you have dihydrate stones. Mono is single, but for single there is this double shaped, like dumbbell shaped, two, no? But for dihydrate you have this single envelope. For di you have the single envelope, for mono you have the double, like the dumbbell shaped. So it's in reverse order, you have to remember this. And what is the final picture? This is a rhomboid shaped. You remember it like this, you write u like this, no, and a reverse u, so it is like rhomboid shaped. Rhomboid shaped is u, uric acid. Uric acid stones are in rhomboid shaped. So let us see which is the correct option. Calcium oxalate dihydrate. Dihydrate we saw it as di is for mono envelope. So this is not the correct option. Uric acid stones. Uric acid, what did he give? The coffin lid he gave. But uric acid, as we spoke, are rhomboid shaped. So this is also a wrong option. What is the third one? Calcium oxalate monohydrate. Mono we thought as double, the dumbbell shaped. So this is the correct option. Let's see the fourth one. Cystine stones. Cis for 6. 6 is like hexagonal. But what did he give? He gave the rhomboid shaped, which are nothing but uric acid crystals. So this is also a false option. So what is our answer? It's this third option. What are the other shapes of the renal stones we know? We have these needle shaped, like needle shaped renal stones are there. This is known as brushite. You remember it just like a brush which has these needle like projections. So brushite is a needle shaped renal stones. We also have this envelope we already saw, and we have the staghorn like renal calculi, which are triple phosphate stones. We call them as triple phosphate stones or staghorn calculi, which obstructs most of the renal pelvis, like it is a large stone, no? These triple phosphate includes calcium phosphate, magnesium phosphate and ammonium phosphate. These three are the triple phosphate stones. So let's see the next question. All are true about choledochal cysts except. What is a choledochal cyst? Choledochal cyst is nothing but you have your liver like this, you have this gallbladder from which cystic duct is coming. From liver, this common hepatic duct is coming. This both join together to form the bile duct. So if there is any cystic dilatation in the bile duct, you call it as a choledochal cyst. So let us see the options. Bosniak classification is used to classify the choledochal cysts. We classify these choledochal cysts through the classification called as Bosniak, is what he is saying. But what is the classification used for choledochal cysts? Todani's classification is the classification used for the choledochal cysts. This is for renal cysts. So you have to know these named classifications. You have to remember them. He might ask one of them. So next option. Option B is what? Liver transplantation is the treatment of choice for type 4B, he's saying. So first let us see the types of the choledochal cysts. So this is type 1. I told you, this is the bile duct. Where does the bile duct open into? Into the second part of the duodenum at the ampulla of Vater. This is the ampulla of Vater. So if there is any saccular dilatation, just the dilatation of the type 1 is dilatation of CBD. Type 2 is what? Type 2 is diverticulum. It's not just a dilatation, but there is a protrusion, like a diverticulum is present. That is the type 2 choledochal cyst. What is type 3? This is the intraduodenal part. The part which is opening into the duodenum is dilating. This 3 is for this 3 is for D, like the fourth letter, third number and fourth letter, like that you remember. Type 3 is for the duodenal part. The duodenal part dilates. Type 4, we have type 4A and type 4B. Type 4A is both intrahepatic and extrahepatic dilatations are present. Type 4B is only extrahepatic dilatation. And type 5 is only intrahepatic dilatation. This means that the part present inside the liver, the ducts inside the liver are only dilating, the outer part is normal. So this is the classification. Type 1 is just a dilatation of the CBD, type 2 is diverticular of the CBD, type 3 is intraduodenal part. Type 4 is both intra plus extra. Type 4B is only extra, and type 5 is only intra. 4B only extra, 5 only intra. This you have to remember. And this type 5 is called as our Caroli's disease. This is also an important question. This is asked so many times. Like he might also give the radiological image for this. So type 5 is the Caroli's disease. So let us go to the options now. So what is he saying? Liver transplantation is the treatment of choice for type 4B. What is 4B? 4A is both intra plus extrahepatic dilatation. 4B is only extrahepatic dilatation. And 5 is only intrahepatic dilatation. So here he's telling for 4B the treatment is liver transplantation. But where are the 4B dilatations? Outside the liver. So there is no use in transplanting the liver. So this is the wrong option. But where do we do liver transplantation? Where there are intrahepatic dilatations. Like in type 5 we have both, no? Like in type 5 we have only intrahepatic. So there is absolutely liver transplantation is the only treatment for type 5 disease. Whereas in 4A we have both intrahepatic and extrahepatic. Here also we can do a liver transplantation. But absolutely if he asks, then you have to go for type 5. So let's go back to the question. The third option is most common type is type 1 followed by type 4. So based on like common things, type 1 is more common than type 4, which is followed by type 3. You can remember it as 1, 4, 3. So this is also a correct option. First one is wrong option, second one is wrong option, third one is correct option, and fourth is investigation of choice is MRCP. So the investigation of choice for choledochal cysts is MRCP, which is magnetic resonance cholangiopancreatography. So this is also a correct option. So we have two wrong options here. This both can be considered as a multiple choice answer. So let's go to the next question. A 35-year-old man underwent an accident and had fractured his pelvis. So there's an accident and then he fractured his pelvis. On examination, there's blood at the meatus. So this is indicating that there is an urethral injury. Then pelvic hematoma is present. Urinary retention is also present. Okay, this is also indicating there's an urethral injury. And what is the most probable location of the injury? What is he asking? He's asking about the location of the injury. So first of all, let us see this whether this is an anterior urethral injury or a posterior urethral injury. An anterior urethral injury is mostly seen in road traffic accidents. And this posterior is commonly seen in a straddle injury, or classically he will give in the questions as manhole injury. So this anterior, like first see this picture, just let me explain you the urethral parts first. So this is our bladder. This within the prostate is our prostatic part of the urethra, prostatic urethra. And this part between the prostatic and this is the bulbar urethra. So between the prostatic and the bulbar is our membranous urethra. This is our bulbar urethra, and this within the penis is the penile urethra. So first let us go. If there is any anterior injury due to this pelvic fractures, the membranous urethra is most commonly affected. In anterior injuries, membranous is most commonly affected. Within the membranous, bulbomembranous is more commonly affected than the prostatomembranous. That is in what? That is in anterior urethral injury. But in case of a posterior urethral injury, where the straddle injury means like when he is landed on some cycle or any pipe like that, this is a straddle injury. So from posterior, no, then this part, the bulbar urethra, is most commonly injured. For posterior urethral injury, bulbar is most commonly involved, and in anterior urethral injury, in that membranous also, bulbar membranous is most commonly affected than the So let's go back to the question. What is he asking? This is a road traffic accident and has a pelvis fracture. So this is anterior urethral injury. Pelvic fractures and pelvic hematomas are seen in anterior urethral injuries, whereas in posterior he'll give a butterfly shaped hematoma. Butterfly shaped hematoma, because here the scrotum, the shaft of the penis, everything is involved, which gives us the shape of butterfly. So butterfly shaped hematoma is seen in case of a posterior urethral injury, whereas in case of an anterior urethral injury you see a pelvic hematoma. So these are the differences between the anterior and posterior. But when you go for treatment part, for both you do an suprapubic cystostomy, which is followed by a permanent like elective procedure later on after 3 months, urethroplasty, like that. After 3 months you go for an elective procedure.